Welcome to Wednesday's edition of COVID-19. The daily tally has rebounded to hit above 1,000 cases today, while the death toll remains in the double digits. Also starting today, the Greater Seoul area faces a stand restriction on social gatherings, while the rest of the country will see the same regulation starting tomorrow. I have our Kwon So-ah now standing by to start us off with the pandemic updates. So I believe today's total infection number is the second highest on record for Korea.
It is, Sunny. For the past 2 days, we had numbers in the triple digits, but now we are back to over 1,000. And health experts believe that we might even see numbers rise to around 1,200 in the next days. Now, it was last Sunday when we had that record high figure of 1,097 infections, but we see not a big difference here on Wednesday. Meanwhile, yesterday we reported 869 infections, but there has been a revision to 867 as there was an error in the count in Gyeonggi-do province. And with that, the total figure here in the country stands at 52,550. And we also see another double-digit figure of deaths reported in the past day at 17. Now, the government is, meanwhile, continuing its focus on detecting as much as cases as possible fast, and that through massive screenings. On Tuesday, some 107,000 tests were conducted, and along with around 54,000 at temporary test centers in the metropolitan region, which so far confirmed 754 cases in the span of 10 days. And the capital region reported over 700 domestic infections this Tuesday, but we see almost the entire map is in red, which means also other places in the country are seeing double-digit figures in daily cases. In fact, over 340 were reported outside of the capital region, and that was the highest figure for that part since the third massive outbreak here in the country, and which is why authorities are again calling on citizens to follow the ban or strong recommendation on private gatherings of 5 or more people, which started in Seoul, Gyeonggi-do province and Incheon today, and in the rest of the nation will start tomorrow.
This doesn't necessarily mean that it's completely safe to gather, as long as it's in groups of 4 or less. The risk of COVID-19 infection doesn't go away, even if you gather in small numbers. So, we urge you to cancel all gatherings and other arrangements. And do understand that getting together in groups of 5 or more poses especially high risks.
Right, and we are poised to have more on that with our Kim Han later on after your segment, So-ah. Meanwhile, the government here has also decided to temporarily halt air traffic with the UK.
Right, Sunny. Korea is joining some 50 other countries in suspending flights to and from the UK, and that due to worries over a COVID-19 mutation over there. And also, entrants from the UK are to be tested for COVID-19 even after a 14-day self-isolation quarantine period. And the fever standard at checkpoints will be lowered to 37.3 degrees Celsius from 37.5 degrees. And a country that's also worried about this mutation is the US, which is worried that already that variant has made its way into the US. And this is why authorities and high-ranking officials are continuously encouraging people to get vaccinated for COVID-19. And the nation's top infectious disease expert Anthony Fauci has been vaccinated on live TV Tuesday, telling Americans that he feels extreme confidence on the safety and efficacy of the vaccine. And this comes a day after President-elect Joe Biden got his vaccination as well. And if we take a closer look at the numbers around the world, the U.S. is a country that's now seeing almost 18.7 million cases and reported over 210,000 in just a day. And the UK here, where we have that COVID-19 mutation, had reported over 36,000 infections in the span of 24 hours. And another concern in another European country, Germany, has surpassed the total amount of cases of Argentina. And with that, the total number around the world stands now at 78.3 million. And also, the daily death toll is close to 15,000. And those are the updates I have for now. I'll be back with more tomorrow. Sunny?
All right, So-ah, thank you. See you tomorrow. As mentioned earlier, starting from today here in the metropolitan region and tomorrow nationwide, all social gatherings of 5 or more people will be banned until, that is, the 3rd of January. For more on these measures and others, I have Kim Hanul here in the studio. Welcome, Hanul.
Hi, Sunny.
Right then, let's talk about work-related gatherings, Hanul. If the producer of our show, COVID-19, wanted to take people, including you and me and other staff members, out for lunch, would that be allowed?
So if it involves 5 or more people, the short answer is no. So if you want to take people out for lunch, restrict the number to 4, or if the company has in-house dining services, you can still eat together if there's 5 or more people, as long as you follow the strict guidelines of 2.5 social distancing. So exemptions have been made for business conferences and business trips, but otherwise non-essential gatherings of 5 or more people are banned at the workplace, whether it is indoors or outdoors. If you must hold a working lunch, for instance, you have to show proof that it was for necessary business purposes.
I see. Meanwhile, Hanul, what are the rules governing public use facilities such as movie theaters?
Right, so you can still go to the movies, you can attend concerts and go grocery shopping, but you still have to wear a mask at all times and no food and drinks are allowed. However, what you cannot do is make concert bookings for 5 or more people. So the aim here is to restrict people from assembling in large groups, but not necessarily limiting their access to venues with more than 5 people. Restaurants also cannot take reservations of more than 5 people. And the same goes for people trying to bend the rules by splitting a large group and making separate reservations under 5.
And what about the new restrictions on sporting activities, Hanul?
Right, so for golf enthusiasts here in Korea, this could be unwelcome news because foursome plays are no longer allowed at the golf course unless you're willing to play without a caddy. So many golf courses here in Korea only accept bookings for foursomes with a caddy accompanying the group. But that means a total of 5 people, which is, of course, prohibited under the new rules. Caddies are also a requirement at many golf courses here in Korea, so only groups of 3 would be allowed there. But for golf clubs where caddies are an option, you can still book foursomes as usual.
And authorities have also decided to shut ski resorts and popular tourist destinations.
Right, so winter ski resorts are a popular destination for family and friends, especially during the holiday season, but this year they will be closed. Take a listen.
Winter sports facilities such as ski resorts, skating rinks, and sledding hills will be shut down nationwide, as they tend to attract many visitors and may increase the risk of infection. For the same reasons, accommodations such as resorts, hotels, and guest houses will only be allowed to operate at 50% of their guest capacity.
Also, major tourist hotspots where people gather to watch the sunrise on New Year's Day, such as Jeongdongjin Beach at Gangwon-do Province and Homigot Beach at Pohang, Gyeongsang-buk-do Province, have been ordered to shut down from Thursday to January 3rd. Also, all national parks and popular public parks, such as Namsan Mountain Park in Seoul, will be closed until January 3rd as well.
I also hear major department stores are worried about possible closures to stem the spread.
Right, so under level 3 social distancing, which the government is reluctant to pull the trigger on, large retail stores with floor space exceeding 300 square meters will be ordered to shut down, and that includes all department stores nationwide. Typically, the holiday season is the most profitable time of the year for these department stores, but this year, their revenues have taken a serious hit. Shinsegae department store in Gangnam, which has the highest daily sales volume in the nation, has been partially shut down 8 times this year due to outbreaks. According to industry officials on Tuesday, the top 3 department stores in Korea, Lotte, Hyundai, and Shinsegae, are all preparing to strengthen their online sales platforms. Lotte Department Store plans to launch live commerce broadcasting services to promote in-store brands, while Hyundai and Shinsegae both sent out official letters yesterday to its partners to register their brands on their online shopping platform.
I see. All right, Hanul, thank you very much for that report. Hope to see you again soon.
See you then.
A while back, we spoke of efforts here in Seoul to address the shortage in hospital beds by turning shipping containers into modular isolation wards. According to city officials, as of yesterday, about 10 COVID-19 patients are currently receiving treatment at these wards. Meanwhile, we were there earlier to bring you this report.
Hi, it's Shin Se-byuk and I am at Seoul Medical Center. As the COVID-19 resurgence is accelerating nationwide, the Seoul city government is working to build temporary hospitals and shipping containers to brace for a possible shortage of hospital beds. So without further ado, let's take a look at the construction site.
경증 환자를 위한 생활치료센터는 차질 없이 확보돼 가고 있지만 중등증 이상의 환자를 치료하기 위한 병상 확보는 더딥니다.
As of December 22nd, bed occupancy rate at COVID-19 treatment centers are reaching 85.5%, meaning only 90 out of the 793 hospital beds are available.
의료 자원을 총동원해서라도 치료를 받지 못하고 무작정 대기하는 확진자가 없도록 현장 중심으로 대응하겠습니다.
So temporary wards for coronavirus patients are under construction outside the Seoul Medical Center. Its original plan was to get it done within the month of December. However, with the rapid spread of the virus, workers are hustling to get it done within 2 weeks.
This is what the container hospital looks like. And once construction is completed, it would make a total of 48 hospital beds. Also, each ward is equipped with air conditioning system, medical equipment, oxygen supplies, and a TV.
So each container has 3 single rooms, a bathroom, and a shower room, and there are negative pressure devices installed inside each container to prevent further spread of the virus. And it is freezing cold, so there is obviously heating machine inside. However, some are concerned over relatively poorer conditions compared to other ordinary ones.
These temporary structures serve as a recovery ward for severe COVID-19 patients that have undergone treatment and are in the recovery phase. Starting with the 48 beds at Seoul Medical Center, a total of 150 COVID-19 wards will be installed at 3 additional hospitals.
So Seoul City said it plans to operate it flexibly, such as by transferring those in temporary hospitals to ordinary ones whenever it's available. A new year is right around the corner, and I hope it would be a worry-free 2021. Until then, it is more than important to follow government guidelines at all times. This has been Shin Se-byuk.
Elsewhere, neighboring Japan is struggling to contain an outbreak that healthcare workers claim is overwhelming the medical system there. For more, I have Dr. Harumi Gumi at the International University of Health and Welfare live on the line. Welcome, Dr. Gumi.
Thank you. Thank you for your invitation.
Thank you, Doctor. Let's begin with efforts by the Japanese authorities there to tackle the relentless rise in recent cases, Dr. Gumi. I understand the controversial Go To Travel campaign has finally been suspended.
Right. Go To Travel campaign started back in July. And but at that time, the number of patients with COVID-19 has not been decreased sufficiently yet. But the campaign started and people started to move. And the government said that the recent current sharp rise of the number of patients with COVID-19 has not been proved due to the this Go To campaign. However, obviously the number of people started to move around, and there was a great risk for Japanese people to get infected with the COVID-19. And then finally, all the areas for Go To campaign will be suspended as of December 28th and up to January 11th. So there are no incentives for Japanese travelers to travel domestically.
I see. Meanwhile, this past Monday, healthcare professionals in Japan declared their own state of medical emergency. Please tell us more about the reasons behind this declaration, Dr. Gumi.
Yes. Well, as a medical professional, I myself have been seeing patients with COVID-19 as an outpatient primarily, and we have been increasing number of patients, and then we are really suffering from the lack of resources, human resources, and some personal protective equipments. And then a lot of medical professionals or healthcare professionals felt that the current Japanese containment measures may not be sufficient, and therefore, as a professional, we need to give some messages to the public and then to the government, and then share the emergency situation. That's my understanding.
I see. So as of now, the stance of the healthcare professionals in Japan is that the government needs to do more than Dr. Gomi.
Right. Well, I mean, the situation is a little bit different from other Western countries because here in Japan, we don't have the legal enforcement to lock down the cities or lock down the country. And everything was more like arbitrary request from the government. So some people will follow strictly and some people will not. And then that kind of ambiguous measurements. I mean, so far it was okay, but at the moment, because of the sharp rise, due to multiple reasons, including go-to campaign. So therefore, we need to try our best as a healthcare professional.
Right.
That was the situation.
Meanwhile, Dr. Gumi, what measures are in place to address the shortage in supplies and staff that you mentioned earlier to treat COVID-19 patients?
Earlier, there was a scientist investigating the resources, both hardware and specialists, or critical care specialists and infectious specialists. And then the group concluded that the number of professionals and the number of equipment such as ECMO, the number may be sufficient. However, the distribution may not be effective enough. So therefore, it could be the distribution issues. But to change the distribution, we need to have a really nicely organized healthcare systems. You may have to reform the systems.
Dr. Komi, what is the COVID-19 testing protocol in Japan? I mean, how many tests are conducted on average per day there?
Per day. Well, I don't have the solid data, the real-time data, but at the moment, the Japanese Ministry of Health, the website indicated that we can test theoretically over 100,000 tests. We can perform over 100,000 tests. Earlier, it was much lower, but at the moment, the capacity-wise, over 100,000 tests can be done per day.
I see. Meanwhile, what is the latest regarding the vaccination campaign in Japan, Dr. Gumi?
Well, I don't think there is a campaign for the vaccination, but vaccine campaign for example, influenza. We are trying to, as a professional, we're trying to ask our patients to get vaccinated for influenza and pneumonia vaccine. And on top of that, this year we have to promote coronavirus vaccine once it is approved by the government. At the moment, the vaccines by Pfizer has been submitted to the Japanese government, and then the government is trying to approve it by the end of our fiscal year, that is March 2021.
I see. Dr. Komi, out of curiosity, what is the Japanese public's response to COVID-19 vaccination?
To be honest, I'm not sure. In Japan, we have a lot of problems on the vaccine policies. For example, human papillomavirus vaccine has not been promoted aggressively compared to the other countries. But influenza vaccine has been accepted very well. So I'm hoping that as a healthcare professional and infectious specialist, corona vaccine can be promoted as like influenza vaccine and pneumococcal vaccine.
All right, Dr. Komi, thank you very much for making the time to share with us your thoughts at this hour.
Thank you.
Right, up next, we seek to offer you the facts and fiction about COVID-19 vaccines as countries including the UK, the US and Canada have started their inoculation campaigns. Do take a look.
fake news and misinformation about COVID-19 vaccines have been spreading quickly on the internet, with the head of the International Red Cross even describing it as a parallel pandemic of distrust. While some skeptics have raised questions over the true efficacy of the vaccines, others have gone further by suggesting that getting inoculated could even change a person's DNA. Another viral post on social media claimed that cells extracted from aborted fetuses had been used in AstraZeneca's vaccine.
mRNA는 몸 안에 들어오게 되면 바로 단백질로 번역이 돼버리기 때문에 우리 몸의 유전자에 삽입될 가능성이 없고요. 바이러스 벡터 백신 같은 경우에는 이미 제조 당시부터 그 바이러스는 재생산이 불가능한 구조로 되어 있습니다. 다시 복제가 일어나지 않는 것이죠. 따라서 우리 몸의 유전체에 그런 바이러스 물질이나 이제 새로운 유전체가 삽입될 가능성은 없다고 보시면 됩니다. 우리가 실험실에서 실험을 하는 과정에서 사람의 세포를 써야 되는 경우가 있습니다. 그건 실험 과정에서의 데이터를 얻기 위한 목적이고요. 실제 생산 과정이나 아니면 제조 과정에서 그런 것들이 사용될 가능성은 없습니다.
Another toxic rumor that's been circulating online since the early days of the pandemic claims that COVID-19 vaccines were being used as a cover by tech giant Microsoft to implant microchips in the global population.
새로운 코로나 바이러스에 대한 공포심 때문에 이러한 백신에 대한 위험 비어가 생기는 것 같습니다. 과학적으로도 가능하지도 않지만 이 짧은 시기에 아직 백신 개발도 안 된 상태에서 그러한 일은 일어날 수 없다고 생각합니다.
Microsoft founder Bill Gates denied these conspiracy theories and said he would get himself vaccinated as well. Meanwhile, one of the arguments being made by anti-vaccination supporters is that the low fatality rate of COVID-19 makes inoculations unnecessary to begin with. Although it is true that most patients, barring those in high-risk groups, are very unlikely to die from COVID-19, getting vaccinated is more than just about protecting yourself.
Now, the infection fatality rate, that's the number, that's the risk of dying if you've had the infection. Again, it shows a similar relationship with age. So your risk of dying from a COVID-19 infection, if you are a young person with no pre-existing conditions, is very low. If you are young, having the vaccination won't change your risks dramatically, but it could make a big impact to the population on a wider level and reduce the risk that the oldest and the people with pre-existing conditions will die from this disease.
Experts are worried that this barrage of fake news and misinformation could lead to vaccine hesitancy and undermine global efforts to achieve herd immunity.
백신의 효과와 안전성에 대해서 많은 고민과 검토를 하고 있습니다. 그래서 우리 사회라는 게 하나의 조직으로만 돌아가는 게 아니고 아직까지는 상호 검증 체계가 잘 이루어지고 있다는 것을 좀 이해해 주시면 좋겠고요. 그리고 시민들께서도 이런 SNS나 카톡에서 발표되는 그런 소식들보다는 조금 더 사실에 가까운 정보를 얻기 위한 직접적인 노력을 어느 정도 해주시는 게 좋을 것 같습니다.
Stay accurately informed and learn to be more discerning about the information you find. Because not only are we fighting a global health crisis, but also a pandemic of misinformation and deception.
(5인) 이상의 사적 모임, 회식, 파티 등은 취소할 것을 권고드리고 겨울 스포츠 시설은 전국적으로 집합 금지됩니다.
We've currently identified over 1,000 cases with this variant, predominantly in the south of England.
News of a coronavirus variant over the UK is triggering much public concern. And in today's studio session, we ask our panel of experts just how concerned we should be. I have Professor Kim Moon-gyu from Yonsei University. Pleasure to have you back, Professor Kim.
Nice to meet you again.
And I also have Professor Kim Sung-hee from Hanyang University. Welcome to the program, Professor Kim.
Nice to see you.
Right, Professor Kim, before we touch upon news of the mutation over in the UK, let's start a little bit with the situation here in Korea. Authorities in the country have claimed that this week is crucial with regard to the course of the latest outbreak. What is the reason for this claim, and what are your prospects for the days ahead?
I agree that it's very crucial right now, but it's hard to understand the background because I have not much understanding about the politics and economical situation. But if I limit to the purely medical science field, we should have leveled up our quarantine weeks before, because it's a little bit late, but well, because this is winter season and this kind of respiratory virus are very easy to spread in this situation. So I'm expecting there are possibility that the COVID-19 confirmed cases will be increasing a little bit, and usually it follows the exponential pattern if we don't do anything. So we have to enforce our efforts on quarantine.
I see. Professor Kim, starting today here in the metropolitan region and tomorrow nationwide, like we said earlier in the program, social gatherings that is, of 5 people or more will be banned. Do you suppose this ban itself is an indication of the severity of the latest situation?
Yes, it is. It is indeed a serious situation. So we have now daily 1,000 patients. This is the number that we have never observed from the beginning of pandemic. So you are absolutely right that this is a very serious situation. On top of that, the other indicators such as the positivity rate among those tested and the short-term mortality rate among those infected, they are not decreasing either. So this is very serious situation. However, I have still optimism given that it never doubled as it happened in other countries. For those countries which reached 1,000, they easily see 2,000, 4,000, 8,000 very rapidly, but this doesn't happen up to now. It seems like that we have reached the saturation of the curve.
I see. Professor Kim, aside from the ban on social gatherings, ski resorts are being closed and hotels as well as other accommodation facilities have been asked to limit their capacity at 50%. What are your thoughts on these restrictions? And are there any other restrictions that you believe are necessary?
Well, if you look back at the USA, they had a huge concern before Thanksgiving. And since we have the data after Thanksgiving, there was no surge because of that Thanksgiving. So it was lucky. And the USA have a relatively loose quarantine measures compared to our country. So that was good. But when we look at our situation, this is winter time and it's not the same. And we have quarantine measures, but we have to double check whether this measure is done evenly, fairly for all the areas, like for the church, for the restaurants, for the sauna. We have to double check whether it's doing fairly. And I welcome that we have more precise and detailed guidelines, which is quite different from the beginning of this pandemic. So I welcome that. And if there's any facility or any place that you cannot close, then you have to limit the numbers and keep the distance enough between persons. And finally, I insist that we need more manpower on quarantine measures. I hope that the government will work out, including the volunteers, but the government has to do more.
I see.
For manpower.
I see. Professor Kim, let's now turn our attention to the COVID-19 situation over in the UK by focusing on the mutation circulating in the country, which had started back in September, I understand. First, is the coronavirus more prone to mutations?
In general, all viruses are very prone to mutation. That is true. If we compare coronavirus to other viruses, it is not a very fastly changing virus compared to other RNA virus, but it's the nature of virus. So we have to bear in mind that it will happen anytime. And what happens to this mutation is that they have made alteration into the spike protein. So spike protein is a hook on the envelope of the virus, and they can anchor the virus itself into the host cell, so that helps virus to get into the human body.
I see. I was actually going to ask you what a spike protein was, but you've already answered that question. All right. Meanwhile, Professor Kim, there appears to be much global attention on the latest variant over in the UK. Why is this the case? And what can you tell us about apparently news that some researchers there have hinted the impact of this variant on children may be greater?
Just as the Professor Kim mentioned, it's something we have to expect until the end of the pandemic. This virus name, they call it B117 by the COVID-19 Genomics Consortium in UK. And it first appeared in September, actually. And in this mid-December, it composed of almost 2/3 of the COVID-19 case in UK.
Oh, so it's been replacing the other versions of the virus.
Yeah, that's correct. And it's up to 70% more transmissible, and increases the R number about 0.4. So if it was 1, then it becomes 1.4. And that means more transmissible. And as you mentioned, this new strain can infect children as much as adults. The previous strains used to infect less for children, but now it seems to be almost the same. But luckily, until now, there's no evidence that it increases the severity yet. So we have to wait for the final results from the COVID-19 Genomics Consortium of UK.
I see. Professor Kim, I understand the mutation detected over in the UK is unusual because it has about 20 changes, including a few involving the spike protein that you mentioned earlier. Now, usually the changes would be 1 or 2. Is that why this latest variant is so highly contagious?
That might be possible, but up to now, we don't have the complete figure. That will be discovered quite shortly. But I guess that might have some impacts on this changed nature of the virus. That would be true.
I see. So up until now, very little is known about this variant, aside from the fact that, like Professor Kim Moon-gyu has mentioned, it's highly transmissible, and like you pointed out, it affects a very important part of the virus, and it's replacing other versions of the virus out there. Investigations right now are underway to check the impact of the current vaccines on the new variant. What are your thoughts on this endeavor?
Up to now, what I can say is that because this is very new virus, and many of researchers across the world, they are working very much, but we don't have all the evidence to tell us what is really the situation. So there is, until today, what I can say is that there is no evidence that this new variation would cause any impact on the vaccines. It may be in the future, but it could happen if there are many more mutations. But as of now, we don't have any scientific evidence to make a conclusion on that.
I see. And despite that reality, pharmaceutical companies, including Moderna, have voiced optimism about the efficacy of their vaccines, even on the new variant. What do you suppose is fueling their optimism?
In general, these vaccines are not designed to only target that special part of the virus. So when we say, we know that this has already changes in spike protein, so that may contribute to increased infectiousness of this virus. But vaccines are not designed to only target this part of the virus. They are designed and developed to be to have broader broader scope of efficacies. Even if we test them and we do have a lot of evidence from the laboratory, for many vaccines we don't know why it works. So for the coronavirus vaccine, we also, the pharmaceutical companies, they envision that this could also happen to this coronavirus vaccines. And even if there are some changes in very small part of virus, it is highly likely that immune system will be challenged and our immune system will produce necessary antibodies.
I see. Professor Kim, following news from the UK of this variant, several European countries, including Belgium and Italy, as well as Australia, they've talked about detecting the new strain in their territories, while authorities in the US and even Germany are claiming chances are high that the new variant from the UK is already inside their territories. Are we looking at a fresh resurgence of relentless cases worldwide?
Well, if the new strain is more transmissible, it's common that the new mutant takes over the previous one. And I would like to mention briefly about the mutant which was found in Chile in October. The mutant was confined to a very small area called Patagonia, which is the southern end of Chile. And that location was very distant, so it didn't impact any other countries. But UK is different. It's one of the central countries that so many travels and communications going around. So UK has a more chance that might spread all around the world. So we have to watch carefully how it goes on about this cluster outbreak.
I see. Would you propose perhaps extending the closure of schools just to check whether this...
I would say that we have to block the all the air flights from UK, and the school is something different issue. So after 1 or 2 weeks, we will see that how it's affecting children, and that will decide whether schools should be closed or not.
I see. And just like you said, the government today has announced its plans to suspend air traffic with the UK. Professor Kim, what are the chances of widespread public vaccinations fueling more coronavirus mutations?
There is a notion that viruses will be more aggressive if they can infect less people. Because when we acquire immunity, there are less number of people who are susceptible to virus, and it may give an idea that the virus would be more aggressive. And scientifically and technically, it may be possible because it's true that with less number of susceptible people, it may be more difficult for virus to survive. Because when we are all susceptible, they can swim around, but now they can only survive within very few number of people. And it's true that researchers, according to researchers, that this virus are expected to gain more and more useful mutations that will help them to spread more easily. That is very true. So what we should do is that all the scientific community need to very closely monitor, as we are doing now, what are the new mutations and is there any change in the epidemiology of the same population.
I see. Collaboration will be of utmost importance then. Professor Kim, back here in Korea, authorities recently called on major hospitals to allocate a portion of their beds for COVID-19 patients. What is the situation like at the Severance Hospital of the Yonsei University Health System where you work at?
Rise of fatality does not necessarily mean that the virus is more virulent. But now we understand better about this COVID-19, so during the summertime, the fatality decreased worldwide. But I think it's a problem of accessibility and available beds and ventilators and the manpower who takes care about COVID-19. Already hospitals are crowded with various patients, not only COVID-19. And our Severance Hospital has to increase more than double the beds already we have for COVID-19. So it's a very difficult task, and I would say that it's catching two rabbits at once. So we're preparing and gathering the nurses and doctors who can work at that ward.
I see. What efforts, Professor Kim, are being made to ensure care for patients of other diseases amid such calls for more attention on COVID-19 at your hospital?
We try not to delay any emergency operations, and if there is any medical procedure, it can be done about a month later. We try to postpone it, and also we do our best to prevent any doctors or nurses or any medical personnel get infected from the patient, because they might spread to other vulnerable patients who have a high risk for COVID-19.
Right. Professor Kim, could you take this moment to remind our viewers about the guidelines to abide by when an individual is in self-quarantine or self-isolation?
Firstly, there are two types of self-isolation. There are mandatory self-isolation, but we also have very disciplined citizens who would go self-isolation without the request from the health authority, which is a very good sign. It may not happen in many other countries. One thing I would really highlight is that if you are to quarantine, even if at your place, you should wear a mask all the times with any against to any possible contacts. What we observe these days is that people tend to wear the mask outside of the building, and inside the building, they feel more relaxed. And then even with the close persons nearby, we tend to talk without wearing masks and so on. So for those who are in mandatory quarantine or voluntary quarantine, everybody would know that they do it to keep the distance from their family or partners. They are their beloved ones. So not only keeping the distances, all the times, 24 hours, you should wear masks, even when you're sleeping.
I see. As a medical professional yourself, Professor, what is better, using water and soap to wash your hands or using a hand sanitizer?
Water and soap.
I see.
That is always the best. There are very good photos. If you can, it's easily be searched in Google that they have let the bacteria grow after each type of the hand washing. So soap and water and alcohol sanitizer. You will see that even with the alcohol sanitizer, you will see that some of the bacteria colony, they would survive.
I see. Professor Kim, meanwhile, there have been a few cases of people in need of emergency care failing to receive such medical attention simply because they are under self-isolation for having come into contact, let's say, with a COVID-19 infected individual. Do we not have a contingency plan for such scenarios?
We do have it, but since the pandemic, there are additional steps required, especially if you have fever or respiratory symptoms. So it makes the whole process complicated than before pandemic. At the outpatient clinic, at the emergency department, even at the general ward. I feel sorry for the patients with underlying disorders. They have to visit the emergency department late because of the pandemic, and that worsened the situation. And actually, if I review the data of our department, we see less patients compared to 2019, but we see more severe cases. We have more intubations, we have more cardiopulmonary resuscitations, and more patients has to go to the ICU. So I think that's because they come to the hospital late and worsen their situation. But we have a network of hospitals and medical emergency system that communicate each other, and we always talk how to refer the patient. We're going to refer it or not, and if any hospital is available, we connect them first. So we have that systems, and sometimes we have to refuse to receive the patient because our department is already satisfied, or we have a confirmed case, so we have to disinfect the whole area. So patients has to understand that situation, and I hope that they may understand. But medical personnel should be proactive to do their best to make available to receive some emergency cases visiting the hospital, such as acute appendicitis. It suddenly happens, but they have fever, so they have to be isolated. So it makes you very a headache, I would say. But we have to be proactive and cooperative with all the hospitals.
Right.
Yeah.
Right. All right, Professor Kim Eun-gyu, as always, thank you very much for your thoughts. And Professor Kim Sung-hye, thank you very much for making the time to be with us today.
Thank you very much.
Thank you.
Right, well, that brings us to the end of this edition of COVID-19. If possible, do refrain from ventures outdoors for social or leisure purposes to ensure a prompt containment of the latest spread. Thank you for being with us today.